In speech therapy, we support people who need help with communicating and making sure that everyone has a voice. My name is Kristin Wenger. I'm a speech pathologist and clinical director here at the Speech and Language Center. I'm a speech pathologist here, which means that I work with a wide range of disorders related to speech, voice, fluency, language, social skills. Our scope is really wide and we do serve a full lifespan. Lots of variety with what I get to do every day. Some of the populations that I work with include apraxia of speech, autism, speech or language delays, phonological disorders, fluency disorders, feeding disorders, and a lot of our populations may have limited mobility or they may have just speech and language disorders. I typically meet a child with whatever their interests are. So I start with play, and that's really how you get a child interested and motivated. So when they walk in the door, I try not to have a list of things I want to accomplish because that is almost a surefire way to not accomplish any of them. So I often will just open my closet and I'll have them go and pick out whatever they're interested in, and then having a background understanding of what their targets are and how to elicit those, we kind of go from there. One of my favorite things about this field is that every patient is different, and so I may have a 3-year-old who is struggling to say his S's, followed by a 20-year-old working on job skills, followed by a 70-year-old who had a stroke and is trying to regain skills that he had in the past. So each of those populations brings a different set of challenges, a different set of motivators, and then of course their own personality. So learning their personality, learning what motivates them, and then playing on their strengths to help them achieve what they came to therapy to achieve. Over my years of experience, you have this one kid and you're like, all right, X, Y, and Z works for him. So I get the next kid and I'm like, all right, A, B, and C work for this kid. So I just try to pull from different things that I know have been successful in the past and combine that with the evidence. I think when patients are successful in therapy, it gives them autonomy. It gives them the ability to communicate their wants and needs and to just feel heard and understood. And so that's just something that's invaluable. And as a field, I think that is what is the most motivating in this career, is just giving others that ability to be heard.